Hi class, welcome to week 2 of advanced psychopathology. We are going to dig into diagnosing today. I'm going to be mainly focusing on the Morrison text. There are PowerPoint slides in your in the week 2 learning activities. That is for the CAPS text. But this is the one I'm focusing on because I wanted to kind of highlight some things about those first 4 chapters in the Morrison text about diagnosing. That is something that we are going to be doing as clinicians. Maybe this is something that you've been looking forward to now that you've gotten to this point. So I'm really excited to be going over this with you. But anyhow, so we're going to just jump right in. Really quick note. I am very aware that there is a lot of reading. I think I'm going to be kind of highlighting 4 chapters of one text. I know there's 3 texts that show reading for the week. So with that being said, it can be a bit overwhelming and I'm fully aware of that. So please be mindful of this. As you're going through the week, I know you may not be able to read everything word for word. It might have to be skimmed. Some might have to even be come back to later. But just be aware that, like, I am aware it is a lot of reading. With your discussion board posts, like as you're probably going to be seeing, these are what we call vignettes. This is some language we used in the theory class that was last session. If you were in my class, if you weren't in my class, you were probably in another class that was teaching the same exact thing. So this is something you're going to become more familiar with. And basically what it is it's a scenario of something. And then you're going to walk through like maybe a diagnosis or what's going on in the situation. So this is something you are going to become more familiar with as time goes on. Okay. So as I'm looking through these first 4 chapters of this text, it's great. It's a great text, might be something you hold on to, obviously. And so some key concepts that we're looking at is what is a mental disorder? Why do we diagnose? What is the DSM? And the diagnosis why is it useful as a clinical tool? So what is a mental disorder? So a mental disorder is something that is characterized by clinical significant disturbance, right? It's an individual's cognition, emotional regulation, behavior that reflects a dysfunction in psychological, biological, or developmental processes underlining mental functioning. So this could be a wide, obviously, spectrum of situations that comes up. So it definitely causes a disturbance. It affects thinking, feeling, and actions. The symptoms are related to problems in the psychological process, biological functioning, developmental process, and it causes a level of distress or impairment, personal distress, or it makes it hard in work situations, life situations, trying to just function in the real world. The DSM, which is like the Bible of psychology, states that normal reactions to life stressors are not considered mental disorders, right? So, you have grief after a loss, like something happens, like you lose a job, or like we know we have some regular anxiety in our life that's normal, like before a test or an interview or something new. This is something that causes like severe impairment to functioning, okay? Well, I don't mean necessarily severe, but like it can cause severe impairment to functioning. It's not something that it just pops back up. Like when I talk to clients, I'll talk about life stressors versus something that's biological or something that they inherited. Okay. So keyword is like, a significant disturbance, right? So to someone's life. So that is something that that's a way to kind of clarify a disorder. And why is that important? Well, because as we're trying to navigate the DSM and we're trying to recognize, right? So we diagnose to help recognize. It talks about your roadmap in the Morrison text, which there's even a great little diagram in there, which I think is really helpful. We're trying to recognize what is going on with someone. And so if we don't kind of acknowledge what is going on, then we're not going to know. And so the word diagnosis, it comes from the word recognize, to know, and that is a lot of what we do as clinicians. We are recognizing things, and we're trying to help see people for who they are, which not a lot of people do. And so it's important that we diagnose, not because we're trying to create a label, not because we're trying to just give answers flippantly, but because we're trying to better understand what's going on. When we understand what's going on, then we can better understand how to treat it as clinicians. Oftentimes when clients realize, like I had a client just recently, she's been diagnosed with borderline personality disorder. It was like a relief. It's a relief. Like she was doing more research on it. She knows her patterns of behavior. She knows that there's problems in her personal relationships. And it's like it was like a relief to her to be like, I really have this. And I'm like, you do. And so now she can really focus on things she needs to do differently to get out of these same patterns. That takes a lot of self-awareness. This is something that is really huge for her, because one, she's acknowledging, but two, now we can have a strategy. We can have a game plan. We can really tackle this. And so it is helpful. A lot of people don't want a diagnosis. They don't want that label. But it's not necessarily at all a bad thing to have, right? Because we want, if you are, again, this is the stigma of mental health versus if this was like a physical problem. When people are struggling with something physically, like for example, like I'll just throw out something like diabetes. It's like, okay, what am I going to do? Now, you might want to look at all the holistic methods potentially, or you may want to maybe get a second opinion or a differing opinion. Sure, you might have options depending on what type of diabetes and things that you have. You might have an option to try to change diets, and they might give you a little bit of time. But if it's something that you're born with, and it's something that is like juvenile, where it's like there's nothing you can do differently, it's just the way it is, you have to move forward with some sort of treatment, right? And a lot of times it's not that people want a diagnosis of a health condition, but it's easier for people to say, oh, okay, I'll move forward. Whereas with mental health, it seems to be more subjective. And so the goal isn't just to make someone have a label and just be like, well, this is who you are, so be it. That's your excuse for life or something. That's not the goal. The goal is like, now that I understand this, maybe some of it might be the acceptance of, maybe this is something I inherited. Maybe this is something that's part of my my gene pool, and I can't change it, but I can learn to work with it. I can learn to deal with it. I can like strengthen my toolbox. I might decide to get on medication if needed. There's options, but we don't know those options unless we can really truly diagnose someone well. Okay. So that's why diagnosis is important from my perspective. From your text, it's talking about, again, the roadmap. And this is where there's a lot of front work for you as a clinician. We'll probably get into this a little bit more. You will get into this a little bit more in other classes as you're talking about intakes and taking history and getting great information of your clients. We really have to get to know our clients to be able to diagnose them well. Okay. So the DSM though is the book, and it's I think purple now, right? When I was a student, it was gray. DSM-4. We upgraded to the DSM-5. And so it's not about, and your text will really stress this, it's not about just matching symptoms, right? The goal here is to really understand a person. And so the key thing is we need to get information. And so there is a lot of factors that affect what's going on in a person's life, right? We have everyday life factors, right? So what's going on in their relationships, what's going on with them socially, what age are they, what was their life experience? Have they had trauma? Have they had serious medical conditions? Are they having issues with using a substance? Do they struggle with alcoholism? There's a lot of factors that play into what's going on in a person's life. Have they recently had a baby? Is there any significant stressors? Are they recently coming off of a substance? all these things, like, is there religious factors? Are there cultural factors? How long has this been going on for? And so we have to figure out how to paint a picture in order to fully, you really want to paint a picture of what's going on with the person, right? We really want to get a good, clear view, because we don't want to jump to any conclusions. Now, unfortunately, with things like ChatGPT and, my grandma uses WebMD, like, people sometimes come in with diagnoses, and sometimes they could be right. Sometimes they're like, no, that's not your problem. And so we have to be mindful of that. People already have assumptions about what's going on with them. Now, you may have clients come in to see you, who already, come with a diagnosis. They've been to a psychiatrist. They've been in therapy for a long time. They already know. Great. That's fine. I'm not saying you have to re-diagnose them necessarily. You might always, reassess any person just to see what's going on, how severe it is. Is it the same? But there could be someone that's already in care and they come in with this information, which is fine, So again, we want to gather as much information as possible when we are, trying to diagnose a client. So we want to see, what is their presenting problem? What is going on with them? What are the issues? Now I'm kind of trickling into chapter 2, but like, what are the issues that the person is coming in with? Is it because of something going on in their personal life, something going on in their relationship, having a hard time with people at work, having a hard time getting out of bed? They've noticed some bizarre patterns of behavior with their mood, maybe having a hard time parenting. If they're a minor, they're struggling with, school, a lot of different things. So we want to figure out, like, okay, what are some of their symptoms? Like, okay, I'm having a hard time getting out of bed. I have racing thoughts. I just have these thoughts all the time. I have this feeling that if I don't do this, then something bad will happen, right? So that's when we have sometimes obsessive compulsive kind of tendencies. We can go through the symptoms and try to navigate what's going on. We need to know how long have you experienced this? Honestly, a good history oftentimes will take you way back, right? It will take you way back to childhood. Now, for my clinicians, we give an intake type form for clients to fill out prior to coming into therapy. However, oftentimes people don't fill out these things well, and they just, write things like, I don't know, no, none. And so it's good to ask these questions, despite maybe somebody filling out prior. Still ask them to get better understanding. If they didn't answer the questions, go back with them, because sometimes people have been feeling this way for most of their lives, right? Maybe. That's where we can see, maybe, is there a genetic component to this? Asking questions about their parents' mental health is important, because parents' mental health, if it's like something that you notice in your parents and you're noticing it too about yourself, it could be a pattern of behavior that's been consistently happening, so it might be good to, take note of that, because that helps with painting the picture. Add a little bit in here, right? There's a level of a pattern. How much distress is it causing the person? Is it causing functional impairment? Are you not going to work? Are you not able to help out your children, showing up for your kids? At times, has this made you distracted? Is it really hard for you to complete a task or stay on top of things? Yeah, those are important things to take into consideration. We want to make sure we get a good medical history, substance history, family history, how they do with social settings, and again, going into, there's been trauma. Now that might be a really hard question on a first session. You may not get there yet. You're trying to build rapport as well. Again, as a clinician, we're trying to juggle all these things, especially when you meet someone for the first time. Like, they're not comfortable with you. Maybe it's their first time ever doing therapy, which is always intimidating. There's a lot of factors that are happening all at once. And so it's important to, just take all these things into consideration, because again, we're trying to build rapport. We're trying to help them feel comfortable. We're trying to get to the bottom of their story, and they're telling us very personal information. For someone who's done therapy before, maybe that won't be so tricky. For someone who it's their first time coming to therapy, it's going to be really hard, and you're going to sense their nerves, their anxiety, just because they're like, oh my gosh, I'm telling a stranger like all my business, and that's really hard for people. So just taking that into consideration, that's why our skills are so important, and and how we approach people, how we talk to people. It's really important that we make people feel comfortable. We have great eye contact, good listening. I tend to, I try to, we laugh, maybe talk about something that's going on in pop culture, just to kind of ease into what them into the situation, asking them about some of their favorite things, not all the heavy stuff, right? But just as a way to try to make someone comfortable who's like never done this before. Like, you're not going to be like, what brings you here? Oh, okay. When did that happen? It feels cold. It feels like an interview, but not in a good way. And so we want to make people feel comfortable. But this is what we're trying to do, is we're trying to get all the intel so we can make good clinical judgments. Okay. And again, we're not just trying to slap, okay, you have these symptoms, this is what's wrong with you. We really need to look at the whole picture, look at the full amount of information that's been given to us so that we can make a good clinical judgment to really know this person and to know what's going on with them. We need to navigate what could be missing before a diagnosis can be made. Do I really know enough about this? Like, getting a good history. Now, what's hard is, like, for example, my office where I work, my practice, if you use insurance, you have to give a diagnosis every appointment, from the first appointment. So, and it can't be what we call a Z code, which is like, oh, relational issues. They won't pay you for that. And, you're getting in this field to not work for free. So you have to diagnose. Now, you can change a diagnosis. And so even putting something very kind of general, like an adjustment disorder or things of that nature that will still get paid for, but isn't like labeling anything to anybody, anything too intense, isn't going to affect anyone's future, is probably safer, because again, unless the client comes in with already a diagnosis, one session usually is not enough time necessarily to make a call that you're correct on, So just be mindful of that. That is part of the insurance process. Now, if you're planning on working just for cash, then you don't have to worry about that, because diagnosing is good for clinical skills, of course, but you don't have to worry about that pressure of doing it for a first session because you're not billing in the same way. Okay. Just a little tidbit of business information that you have to know. Okay. So let's think about the thinking process. So we're identifying major symptoms, thinking of the diagnostic categories. We're looking in the DSM, and we're ruling out any other explanations and confirm the diagnosis. So we're looking for different symptoms. We are trying to figure out, like, okay, it's not a simple process. So where are we at in the process? So we're trying to navigate through like the different potential clusters of a diagnosis. So for example, is this more of like the anxiety cluster? Would this be potentially a personality issue? Is this potentially something that's in the depression box? Trying to navigate which of these where am I noticing what's coming up based on what the person is saying. We might also be looking at specifiers. So this is where you might find extra information in the DSM, which, could help you with navigating, is this one thing or is this the other thing? Because some diagnosis, when you're looking through the different criteria, like when I think of some of the schizoid disorders, it's kind of like, okay, is this schizoaffective? Is this schizoid personality disorder? Like, which one is this, right? And so you're trying to figure out like how, like, based on the puzzle pieces I've been given and the information I've collected, where does this fit best, and so, you're trying to navigate like Specifiers are extensions to a diagnosis that provide extra information about the characteristics, severity, course, or features of a mental disorder. So trying to navigate like how severe something's going, how much it's affecting the person, if it has unique features to a specific diagnosis. Does this have to do with the progress of the treatment plan? Like if things aren't progressing, what I mean by that, if things aren't progressing and it's kind of like maybe we didn't get this exactly right, like, how can we navigate this? Because we want to be on target, we want to make sure we're treating the right thing. Maybe there could be two diagnoses coexisting, which happens often. You might have anxiety, obviously, and depression. They kind of can coexist. So there could be two things, or maybe as one thing is being handled, now something else is kind of popping up. That can be a situation. And so again, we're just looking for more information to clearly be able to identify what is going on. And so making sure, again, we are we're targeting the right things, right? Which is important. Again, going along with this, medical conditions, like what kind of medical condition, how does the medical condition affect you? How does it affect your mood? Medication, what medications are you on? Some different types of medications can affect different things in your body, can cause depression. I mean, we watch commercials where medications are advertised and we see all the side effects for all the medications. And so those kinds of things can affect a person's mood. So maybe it's not a mood disorder. Maybe it's the medication you're on. Maybe your client needs to talk to a doctor. These are all things that we need to rule out. We have to rule out some of these things so we can best diagnose someone. It's important if someone has a substance problem, like I try to make it clear to my clients from the beginning, look, like, I'm not going to know if you're not honest with me. Like, I'm not going to know that. That's not my job to figure out either. Like, right. It's my job I look at my clients, like what they're telling me is truth. Like, why would it not be true necessarily? And so I think it's important, like, you're not going to get what you came here to get out of therapy if you're not honest with me or yourself. Right. And so I try to say that to everyone from the beginning so that they understand, like, the ball's in your court, person. Like, whatever you so choose to decide to do is on you. But it's not like I'm not here to be judge and jury. I'm not here to judge you, but I need to know the correct information, because if you don't tell me all the facts, we're not going to get it right, right? And so if someone just happens to leave out that they have an issue with like drugs or alcohol, that's a huge problem to just like, oh, well, I failed to mention I have this problem. Because that's something that you need to be able to rule out stuff, it affects people. And so it's important because substance can induce other problems, right? Like so many people I've seen diagnosed with bipolar disorder, and I'm not saying that they don't have major obvious traits of bipolar disorder, but I think when someone has had issues with substance abuse, they're like this, and so people will automatically, oh, they're bipolar. I'm like, I don't know. I feel like they act like they're bipolar. So I understand, but like they have drugs still in their system, or now they don't have drugs in their system and they're trying to navigate and get everything right, And so you have to be careful with that. Sometimes too, with like when we talk about history, when you're looking at adolescents, like they're middle of like going through puberty, like not a great time in anyone's life, right? Necessarily. And so we have to take that into consideration with their behavior, their mood, how they're acting towards their parents, how they're acting towards their peers. Like, is this adolescence? Is this puberty? Is this hormones? Or is this something else? Like, you have to look at all those things, It sounds like very, like we're going to be kind of invasive. And the reality is we are. Like, clients will be like, TMI. I'm like, it's never TMI in here, man. Like, I know all the things. I know all the things about all the things, because like those things matter. And it helps, again, not to keep using this analogy, but it helps give us a clearer picture. It helps us paint the picture. Like if we're filling in, one of those like paint by numbers, let me add this color here, right? Because I want to see the portrait. I want to see a clear view of the portrait. And we won't if we don't ask the questions, if we don't investigate, not in like a police officer way, but in a caring, kind, come alongside you, I'm on this journey with you way. So I hope all this information was helpful for you. You get to do this so soon, and you're going to get to practice this as you have been with our discussion boards, with using the different things we're going to do in this class. Hopefully you'll have a great experience doing your interview with someone who has like a mental health disorder. And so you can better understand what it's like to live with different, mental health conditions. Hopefully you learned a lot in this class. I'm really excited for you. Hang in there. Like I said, I know it's a lot of reading.